The impacts of their disinformation war on repurposed medicine now constitute crimes against humanity, given the global morbidity, mortality, and loss of social, societal, and economic liberties that could have been avoided if such information would have been widely disseminated. I'm calling attention to the corruption. If you look at these innumerable failed policies, there's only one way to understand them. They are literally written by pharmaceutical companies. Almost every single policy serves the interest of a pharmaceutical company. However, if you look outside the United States and look around the world, there have been numerous successes. As one of the world experts on ivermectin, let me just talk about some programs which used ivermectin. My colleagues here, as Dr. Risch just pointed out, there are a number of compounds that we've identified that are effective in early treatment. Almost all of them are repurposed or generic. But let me just say a few words about ivermectin and what it's doing around the world. Not in the United States. In the United States, it's a horse dewormer, it's horse paste, and only the illiterate, ignorant, and or unvaccinated use it. But let's talk about some of those successful programs. Number one, across the world, there have been programs by health ministries which employed either widespread distribution or test and treat programs. I'm going to list them for you today. That medication has been shown to literally solve the pandemic in numerous regions around the world. Mexico City, December of 2020. Their state health system deployed an early test and treat program. They deployed 250 mobile testing units throughout Mexico City, and they had treatment kits. They used and they collected data on 120,000 people. 50,000 of them took treatment kits, and they found in those who were given treatment kits that up to 75% avoided hospitalization. Up to 75% avoided hospitalization. Their hospitals emptied. Argentina, La Misiones, another health ministry, early test and treat with significant dosing for 5-day strategy. They found that over 4,000 patients, again, 75% reduction in the need for hospitalization and an 88% reduction in death. They were avoiding hospitalization and avoiding dying. The miracle of Uttar Pradesh, which is not covered in any newspaper in almost any country around the world. They literally eradicated COVID from its borders. It's a poor state in northern India, using over 70,000 healthcare workers distributed across the country or their state. They visited 97,000 villages. They tested early. They gave everyone ivermectin in early treatment. They gave household members ivermectin for prevention, and all of the healthcare workers took it. In September of 2021, they reported that in 67 of the 75 districts, there was not one active case. Their positivity rate in the previous 2.5 million tests was 0.007%, which is effectively zero. They eradicated COVID from their borders. This was not covered. This was not covered. 2 newspapers in India covered this, and the word ivermectin was not mentioned. The Brazilian city of Itajaí. This is a paper that was published in the last 2 weeks. It is one of the most remarkable studies in the history of medicine because it included complete data on 160,000 people in the city of Itajaí, where that health ministry in June of 2020 offered its entire citizens and inhabitants the opportunity to take ivermectin as a preventative. 113,000 people decided to, and something around 50,000 did not. And when you compared the two groups, even though the group that elected to take it was sicker, older, more overweight, much more disease, they got the disease 50% less. They went to the hospital 68% less, and they died 70% less often. It is a truly remarkable study using immense amounts of data. La Pampas, Argentina, same thing. Early test and treat program showing that the need for ICU or death fell by 50 and 60%. Peru did mass distributions long ago in 2020 until they stopped doing it because the administration changed. But they showed in all of the regions where they did mass distributions, mortality rates and case counts fell. It is a highly effective medicine. Even in Japan, the president of the Tokyo Medical Association announced to all doctors during a summer surge that they should use ivermectin in the treatment. Within weeks, the hospitalization rates reported out of Japan were lower than at any other time in the pandemic. That medication works. And when you deploy an early test and treat strategy, you can cure and solve this pandemic. That information is being buried. Why is that happening, you might ask? I'm going to say that what I've just reported today, that information is being suppressed across most of the world. United States health agency structures and policies created over the last 50 years have tightly intertwined the pharmaceutical industry with public health institutions, resulting in repeated policies placing pharmaceutical industry interests ahead of the welfare of U.S. citizens. The industry's capture of our health agencies, combined with their increasing financial control of most major media, social media, and medical journals, has led to an ability to widely suppress and or distort any information which supports the efficacy of repurposed, low-cost, off-patent medicines. This war has been going on for decades, and this decades-long war on repurposed drugs, waged with the ever-present goal of protecting the market for novel, patented, obscenely profitable, and often barely tested and toxic medications, has reached a pinnacle in COVID-19. It's an absurdity, it's an obscenity, and it's a crime. It has to stop. The impacts of their disinformation war on repurposed medicine now constitute crimes against humanity, given the global morbidity, mortality, and loss of social, societal, and economic liberties that could have been avoided if such information would have been widely disseminated.